So hello viewers, we are now at the Mercy James Centre for Paediatric Surgery and Intensive Care, and we have been joined by Professor Borgstein, paediatric surgeon. Thank you for being here with us today. So my first question to you is, would you give us an insight on how important radiology is for a surgeon based in Malawi?
Right. So surgery depends very heavily on imaging to try and ascertain the nature of problems. And radiology, X-ray and particularly ultrasound is something which is extremely useful in preparing you for particular operations. And in particular in children, ultrasound is safer and it's less painful and there's no radiation. So that's a very useful modality for us, and it's something that even surgeons can learn to use in a basic way and can be very helpful in many situations and help you decide your line of treatment for a patient.
So there's a direct impact on patient management.
Yeah.
Okay. And how do you think that partnerships with non-governmental organizations such as Worldwide Radiology could benefit patient management within a surgical aspect? How do you think it could impact academically with your trainees in surgery?
So we're a pediatric surgery unit. We have an intensive care. We have training programs for pediatric surgery, for general surgery, and the trainees need to learn the imaging. And getting feedback on imaging for them is very important. Getting expert opinion, it's important for us, the surgeons. It's even more important for the trainees, probably. So it allows us to maintain an academic level which we would not be able to otherwise, because Malawi has very few trained radiologists on hand, and radiology does lend itself to remote imaging to some extent. I mean, there are lots of dynamic studies that need to be done as well, but there is a room for remote imaging and expert opinions at a distance, which contribute significantly to the quality of the training program.
And how much radiology is currently integrated into, for example, the surgical curriculum at the moment? Is there any structured radiology approach, or is that also something which we would be able to collaborate on?
Yeah, so it's mostly ad hoc, because a curriculum presupposes that a hospital will have a radiologist who will feed into it. But certainly fast ultrasound training is embedded in our general surgical training, and all our trainees start with a general surgical 2 years, so that's embedded in there. We do expect our trainees to be able to do a basic fast scan, really from the beginning of their training.
Okay. That is it for now.
Okay.
Many thanks for your help, many thanks for your time, and thanks for watching.